you've heard of killing to be kind. This is killing to cure. Death with a purpose. Imagine being declared clinically dead, your heart stopped, your blood cooled to near freezing, all to save your life. This is not science fiction, but cutting-edge medical reality. In this episode, we explore the astonishing world of modern kill-to-cure procedures, where doctors intentionally induce clinical death or suspended animation to perform life-saving surgeries. We're not talking about reviving the long dead, like stitching up bodies or reanimating people into zombies and similar horror film themes.
Oh, I'm alive? Modern medicine is amazing!
We're talking about modern medicine's use of stopping the heart in order to cure someone with legitimate, if ethically questionable, medical procedures. Sorry, Frankenstein. Deep hypothermic circulatory arrest, DHCA, is a remarkable technique developed since the 1950s. Surgeons cool patients to around 20 degrees Celsius or lower, halting blood flow and brain activity temporarily. This pause allows complex surgeries on the heart or brain without damage from blood loss or oxygen deprivation. Though risky, patients can survive with full neurological recovery if time and temperature limits are respected.
We cool him to 20 degrees.
Blood flow stops.
Electrical activity in the brain quiets to nothing.
Core temperature 18.8 and
In
holding.
this frozen pause, time is ours. We can fix what would be fatal at normal warmth.
One of the earliest successful uses of DHCA was in 1952 when surgeons F. John Lewis and Mansur Tawfik performed open-heart surgery on a 5-year-old girl, cooling her to 28 degrees Celsius and stopping circulation for 5 minutes to repair a heart defect. Since then, thousands have undergone DHCA for complex aortic and brain surgeries, with many surviving with minimal neurological damage. There have been some examples of killing to cure in modern TV dramas. For example, in Grey's Anatomy, Season 10, Episode 23, called Shock to the System, Dr. Shane Ross induces asystole, complete heart stoppage, in a patient to stop a fatal tremor, effectively killing them temporarily before bringing them back, a high-stakes experimental procedure. Also in Grey's Anatomy, Season 9, Episode 18, called Idle Hands, Dr. Christina Yang uses therapeutic hypothermia to intentionally lower a patient's body temperature and stop their heart after a severe injury. This technique protects the brain from damage while they perform emergency repairs. In-House, Season 1, Episode 6, called The Socratic Method, fans often cite this episode when discussing, quote, killing a patient to save them. Although the team frequently uses extreme measures like inducing comas or near-lethal treatments to diagnose zebra cases. Also in-house, Season 2, Episode 2, called Autopsy, in order to locate a small, potentially fatal blood clot in a 9-year-old girl with cancer, Dr. House orders the surgical team to stop her heart and drain her blood. This creates a still field that allows them to find the clot before restarting her heart. In The Good Doctor, Season 1, Episode 15, called Heartfelt, a teenage patient with a rare heart condition requires a surgery where her heart must be stopped to allow the team to perform a delicate repair that would otherwise be impossible while the organ is beating. In ER, Season 4, Episode 22, A Hole in the Heart, features a complex pediatric cardiac case where the surgical team must precisely control and temporarily stop the heart's function to repair a critical defect. And, in Season 6, Episode 11, In the Domino Heart, involves a multi-patient domino heart transplant, a high-stakes procedure where patients' hearts are stopped and swapped in a sequence to save lives. Yes, domino heart transplants are real, documented medical procedures, not just TV show fiction. In a domino heart transplant, one patient receives a donor heart, and their original, still healthy heart is then transplanted into a second recipient. This sequential transplant approach is rare and complex but has been successfully performed, including in infants.
Cross clamp in place. Flow looks steady. Ready for the switch?
Ready. Temperature's holding at 18.
Good. Let's bring the donor heart across.
On your count.
For example, in May 2023, New York Presbyterian/Columbia performed the first ever infant domino partial heart transplant, involving 2 babies with different heart defects. The procedure required stopping the hearts during surgery to transplant and retransplant parts, coordinated by a multidisciplinary team of cardiologists and surgeons. Such procedures do involve temporarily stopping the heart to perform the transplant, using cardiopulmonary bypass machines to maintain circulation and oxygenation during surgery. This controlled clinical death of the heart is essential for the transplant process. EPR is an experimental trauma technique designed for patients with catastrophic blood loss and cardiac arrest. By rapidly cooling the body to near 10 degrees Celsius and replacing blood with cold saline, metabolism nearly stops, buying surgeons up to an hour to repair fatal injuries before rewarming and resuscitation.
In an instant, his blood is exchanged for ice-cold saline. Core temperature plunges toward 10 degrees Celsius, and with it, metabolism nearly stops. The heart is silent. The clock.
A notable case involved a trauma patient who was clinically dead for over an hour due to severe blood loss. Using EPR, surgeons cooled and preserved the patient, repaired the injuries, and successfully rewarmed the patient. Remarkably, the patient regained full cognitive function, defying previous limits of survival.
Core temps at 10 degrees and rising. Saline going in.
Rhythm still flat. Charging to 150.
Everyone clear!
Shocking.
Come on, there's movement. Sinus at 32.
Warming him up, heart rate climbing.
Another case involved a 90-year-old woman found collapsed in freezing conditions with a core temperature of 22 degrees Celsius. After 90 minutes of cardiac arrest, she was rewarmed using extracorporeal membrane oxygenation, ECMO, and survived despite severe complications, including brain hemorrhage, demonstrating the potential of hypothermic resuscitation even in elderly patients. In many cardiac surgeries, the heart is intentionally stopped and restarted using cardiopulmonary bypass machines. This controlled death of the heart allows surgeons to work precisely, with oxygenated blood circulated artificially. Some patients have survived prolonged clinical death states with minimal brain damage, challenging previous assumptions about human limits. Others have experienced unexpected neurological effects or prolonged recoveries, revealing the delicate balance between life and death. These procedures raise profound ethical questions. Many patients undergoing EPR cannot consent due to trauma, prompting debates about autonomy and experimental treatment. The blurred line between life and death challenges legal and philosophical definitions, forcing medicine to reconsider what it means to be quote, dead. Philosophers and bioethicists debate whether patients in states of induced clinical death should be considered alive or dead, complicating consent and treatment decisions. The experimental nature of EPR trials also raises questions about risk versus benefit, especially when patients cannot provide informed consent. Modern medicine's ability to kill to cure pushes the boundaries of science and ethics. These life-saving techniques offer hope where death once seemed certain, revealing humanity's relentless quest to conquer mortality. If you enjoyed this creepy but true medical history, hit subscribe and ring the bell for more medical mysteries then and now. Got a weird medical topic you want us to cover? Drop it in the comments.